my name is Jessica. I'm a Bellarmine nursing student, and today I'm in the med prep room preparing medication for a patient. First, I'm going to confirm with the EHR and the patient's their medication. This patient is Meredith DeWitt, date of birth 8/01/1933, and her MR number is 0987. Meredith DeWitt, date of birth 8/01/1933, MR number is 0987, and that all checks out. Perform hand hygiene before touching any of the medication. The first medication is clopidogrel, and this is for Meredith DeWitt. Its medication is clopidogrel. The dose is 75 milligrams. The route is by mouth. It's an oral tablet. The frequency is daily at 8 in the morning, and since the patient was out of there at the time, we'll go ahead and give that now at 10:05 a.m. The next is for Meredith DeWitt. It's cyanocobalamin. It's injectable solution. The dose is 1 milliliter. The route is intramuscular. And the frequency is now and it's active, so we'll go ahead and give that now as well at 10:05 a.m. Next medication is regular insulin for Meredith DeWitt. Medication is regular insulin. The dose is per low dose of a sliding scale, 100 units per milliliter. The route is subcutaneous and it's before meal, so we'll go ahead and give that to her before she has her breakfast. And according to her glucose levels, she was at a 263. So on the sliding scale for 263, she will need 15 units of the regular insulin. And that confirms the first chart of the MR. So now going to say we have clopidogrel, 75 milligrams oral tablet, and we'll put that in the cup to take to the room, and also check to make sure that it's not expired, and it's not, and that the package is intact. Next, we're going to prep the vials, starting with the cyanocobalamin, and it's 1 milligram per milliliter, 1 milligram per milliliter of cyanocobalamin. Going to let that dry. You're using a 3 milliliter syringe because of the 1 milliliter dose. And the needle is a 25 gauge and 5/8 needle because the patient weighs 114 pounds and is female. Get rid of any air bubbles.
Alright, Mr. Lentz, I am going to administer your medication. I'm going to be
Making sure there's no air bubbles at the top as well.
first I'm going to raise your meds to working light. Before I administer the medication, I'm going to locate Mr. Lentz's chromium process, which is here, and I'm going to go 2, 3,
And there's no air bubbles.
and that is going to be my injection site.
Going to remove the needle. Now we're going to put on the label that has the patient's name, Meredith DeWitt. The medication is cyanocobalamin, 1 milligram per milliliter. It's intramuscular and it's given now.
So I'm going to hang the ASF
that with the cyanocobalamin vial.
about 2 inches.
Next is the insulin. And this is regular insulin, 100 units per milliliter. And we checked with the sliding scale, and the patient had a 263 glucose reading. And that was taken at 9:40 this morning and it was a 263. So according to the sliding scale, we're going to deliver 15 units. And this is an insulin-specific needle because it's a high-risk medication, so it's the universal needle for insulin.
Dispose of the needle in the sharps. Just so that your medication has been administered. Dispose of
Make sure that's 15 units. Get rid of any air bubbles.
Are you in a comfortable position?
And now I'm going to have another RN check to make sure. We're going to have another nurse check to make sure
If you need anything at all, don't hesitate.
the dose is correct because it's a high-risk medication.
And I'll also be back in to check your injection site to make sure there's no redness. So if you have anything, don't hesitate.
Okay.
The patient's glucose reading this morning was the 263.
Okay, so I verify that she has regular insulin, 100 units per mil, and according to that blood glucose reading of 263, she will be receiving 15 units of this insulin. Huh?
So now we're going to begin the second check of MR, verifying that we have Meredith DeWitt's date of birth 8/01/1923, 8/01/1933, and her MR number is 0987, MR number is 0987. First medication is the clopidogrel, and that is 75 milligrams. It's an oral tablet, so it's to be taken by mouth, and it is active, and it is given once daily at 800, so at 8 this morning, but because the patient was not in the room, we'll give that now at 10:11 a.m. The next is the regular insulin. It's 100 units per milliliter of injectable solution. The dose is per low dose of the sliding scale, and it's to be given subcutaneously. It's before meals, and it's active, so we give it to her before she has her breakfast. And according to her glucose level of 263 taken this morning at 9:40, we will give 15 units of the insulin. We have 15 units. And the last is cyanocobalamin, and that is 1 milligram per milliliter of injectable solution. The dose is 1 milliliter. The route is intramuscular, and we'll be putting this into her intragluteal muscle because it's 1 milliliter, and the patient weighs 114 pounds. It's active now, so we'll go ahead and give that at 10:12 a.m. And that concludes the second check of the MR.